I'm here with Dr. Rajeev Fernando, a physician with Doctors Without Borders.
Yeah.
Dr. Fernando, you've traveled all over the world as an infectious disease specialist, working on the front lines of the COVID crisis.
Sure, yeah.
Thank you so much for being here with me today.
Oh, it's an honor. Talking to anyone with Doctors Without Borders, it's a great honor. It's a great way for all of you healthcare professionals. If you really want to get a taste, I'll tell you, there are 5 rounds of interviews to get into this organization. I can't believe I passed it, but yeah, great organization. Thanks again for having me.
Yeah, thank you so much for being here. So let's jump into the good stuff.
Sure.
Talk to us about what's going on with vaccines.
Well, there's so much going on. I'm going to try to summarize it in a couple of minutes, but Molly, there's just so much going on. Do you have any specific questions in general? Or?
So here's something I'm wondering. With H1N1, it seems like we came up with a vaccine fairly quickly.
Yeah.
In a global pandemic, what is taking so long? Why don't we have a vaccine yet?
Yeah, I detect your anger in that, and I agree with you. So let's start off with H1N1, which was in 2009. And that was an influenza virus. And influenza, we've been having vaccines for years. And this really required a little bit of a modification. So for all of you out there, when you say H1N1 or H5N9, it really means what position of the flu molecule you see the H or the N. So you just kind of remix it around. And since we had pre-existing vaccines for influenza, it was much easier to make this vaccine. Now for COVID-19, as we all call it, it's a novel SARS-CoV virus, so it's going to take a lot longer. That's why it's taking so long.
So in the last time, we just had to manipulate a different vaccine,
Absolutely.
And this is a totally different ballgame.
Yeah, absolutely. Great question.
Okay. Thank you so much for that. So with that in mind, who would you consider giving the vaccine to? I mean, if they were able to release it early, talk me through that. I mean,
sure. It's a great question. First of all, I want to tell everyone, forget about this November 3rd situation. There should be no politics whatsoever in releasing a vaccine. So let's talk about the different phases. So you have the phase 1 where you test about 20 to 100 people. Then you have a phase 2 trial where you test about 1,000 people. And then many companies are in what's called the phase 3 trial. And the phase 3 trial is what we call a randomized controlled trial, Molly. And what happens, for example, is you have 15,000 people in one arm who actually get the real vaccine, and another 15,000 in the other arm who are receiving a placebo. So nobody knows, the patient doesn't know, things like that. So that's studied over a period of time. Now this period of time is actually looking for rare side effects, just to be on the safer side. And how do you say the vaccine actually works is, let's say it confers protection to about 50% of the people. If you have 50% protection, you're in business. That's when I'm going to say the vaccine works. Now, to answer your second part, where you say who would get the vaccine before the trial is officially ended, firstly, I think vaccine companies, of course, have the ability to end the trial prematurely, which means if they have some kick-ass results, which are fantastic, they say, whoa, we got some great results over here, stop the trial, we can move forward. If that doesn't happen, then it's a clinical decision. So by the time you hit the winter, so we do know new projections are saying there'll be another 225 deaths till December. So we're talking about 400,000 deaths. So are we really, as clinicians, are we really going to sit back and watch while we have 400,000 deaths? So that's when a clinician comes in and says, wait, all right, you're high risk, so you have lymphomas, leukemia, chemotherapy. We would identify those patients as you're high risk for getting COVID-19 and a severe disease. So we would talk to the patient and say, this is the risk versus benefit. Very important point here, I would also have the ethics committee on board as well. Okay. It's very important. We have to discuss, and we say, that we have to be very transparent with the patients. These are the risks versus benefits. And the data that I have so far suggests that this is a safe vaccine. So lots of stuff to talk about over there.
Sure. It sounds like there's lots of considerations as far as the ethics, as far as releasing it.
Very important. Yeah, absolutely.
Yeah. Well, thank you. That actually clears up quite a few of my
That's
questions.
it? We're done?
Yeah, I think.
Oh my God.
There's always more in this great global pandemic we're fighting.
Please join me. Please ask any more questions. And one thing America is, we've noticed with this prediction of another 225,000 deaths by December, calculations have been done which shows that wearing a mask will reduce these deaths from 225,000 to 125,000.
Wow.
So that's a big deal. Questions about the flu, join Molly and me on Friday. We'll be talking about the twindemics to see how COVID-19 will affect the influenza season. So join us in Friday.
And
Later.
in the meantime, wear your mask.
Yes, later.
Thank you. Thank you so much for your time.
Yes.